today. As always, thank you all so much for tuning in, logging on, and just hanging out with me for a little while. Those of you that are watching the live stream, you'll notice that half of the mountain man look has gone away. Uh, my wife got tired uh, of me looking like the creature from outer space. But you know what? It worked for a little while. So we're having an opportunity today for me to sit down with somebody who I can honestly tell you um, is a true friend. And I measure friendship by whether or not they fit on one of the fingers on my hand, because I can honestly count on one hand how many true friends that I really have. Now, that's not to say I don't have a lot of friends or a lot of acquaintances, but in life, there are just times where you have people that no matter where they're at, what they're doing, what they're involved in, if somebody picks up the phone and calls them, they drop what they're doing, no questions asked, and they are there for you. Well, that's who this guy is to me because he knows that's how I am for him. I've had this character on the program before. We have built a wonderful friendship and working relationship over the years. For those of you who have never uh, gotten a chance to listen to Dr. Stephen Soloway on a prior podcast, uh, you're in for a treat. I get a little agita sometimes because I never know the direction that our conversations are going to go, but at the end of the day, they always turn out to be good. So I'm welcoming back my really good friend, Dr. Stephen Soloway, to the program. How are you, my friend?
Good morning. I'm well. Thank you for having me, and I won't give you as much agita as you expect.
So much energy. That's one of the things I love about this guy. He's just full of energy. So, you know, we started our friendship a few years back, and it actually started really as a working relationship. Dr. Soloway is one of the most recognized and celebrated rheumatologists in the world, in my opinion. Um, and I can say that because when I was struggling with my own issues and I had gone for multiple treatments, including surgical procedures on my SI joints, my hips, and I call them surgical procedures. I really consider anytime you break the skin to be a procedure. So we're talking about facet injections. We're talking about different types of steroid injections, all these different things. Even though I've had multiple back surgeries over my life since 1999, and I couldn't get better. And Doc, as I affectionately refer to him, said to me a number of times, Sean, I'll get on the plane, I'll bring the needles with me, and I'll inject you myself, and you'll be okay. And I love Doctor Soloway, but sometimes I'm like, God, man, just give it a rest. You're good, but are you really that good? And the truth is, he is really that daggum good, because I happen to be up in Vineland, New Jersey, for a meeting, and I think he got to the point where he just got tired of watching me not be able to stand up, not be able to walk without pain. I honestly, in my life, I don't take pain medication because I don't ever want to lose the ability to maintain control and to retain my faculties about me. Um, Obviously, with the opioid crisis, there's always a concern. I mean, people become addicted to pain medications after 5 days. I'm grateful that I don't have an addictive personality, but still, there's always that. You know, I'm one of those very conservative types who just if I don't absolutely need it, I don't want it just because I can have it. And Doc said, "Come on, let's go." And he took me into a procedure room. Um, I have tremendous anxiety, because anytime I've had, procedures done, they've always given me a little bit of, anesthesia, what do you call the conscious sedation or,
Twilight.
twilight anesthesia, or sometimes they've given me propofol, and doc is like, "Sean, listen to me. 2 seconds, I'm done. You won't even know it happened." So, I said, "Okay." I lay down on the table, he pulls the fluoroscopy machine over that he has in the office, and he goes, "You ready?" And before I could say no, the needles were in both sides of my SI joints. Now, did I enjoy it? Absolutely not. Did it work? 100%. And I can tell you that I have not had pain in my, um, pelvis, in my SI joints, in my hips. Um, it's been what, 6 months now since I've had these injections.
At
Um,
least.
at least 6 months. I get a little bit of a, pressure, when the barometric pressure changes, if the weather's changing, a little bit of pressure, but man, able to go to the gym, able to do all the things that I always do, run around the winery, so the guy is as good, if not better, um, than what he will tell you he is. So, uh, over our friendship and over the years that we've been working together, Doc asked me to write a foreword for his most recent book. And I got an opportunity to do something that I had never done before. It was one of the most nerve wracking, scary things that I ever did. And I never told him this, but it was because everything that I did for that foreword was forever in writing. There was no taking it back. 5,000, 10,000 copies of the book, whatever he printed, it was forever in there. And, there was no, in hindsight, I wish I could have said, or I wish I would have done. That's it. And then I got an opportunity to come up to New York, to the Trump Towers, and be there for his book signing, which was such a wonderful experience. So, I know I've talked, quite a bit now for the first few minutes, but, I wanna really express my gratitude not only for the working relationship that we built, but for the friendship that we have and that will be enduring for the rest of our lives, and I want people to get an opportunity to get the Stephen Soloway experience on this podcast today. So, again, Doc, it's good to talk to you. I'm looking forward to seeing where this conversation goes.
Well, I will start by saying thank you, and I will acknowledge that real friends are lifelong friends, and there is no exception to that rule. Once you establish a real trust and a real friendship, and real basic fundamentals about how the other person views life and family and so on, and if they jive with your views, then the match of the friendship can never be broken because fundamentally we agree on 99.9642% of whatever the topic may be, whether it's a back pain or whether it's, me hiring you or you hiring me or whatever. But then, of course, the relationship, um, the conversation, and the different topics, and whether it's about baseball, football, skiing, wine, or chess games or whatever, they just flow easily. And yes, you're a lifelong friend forever. And yes, I would do anything for you. And yes, I'm glad I made you get up on the table. And yes, I'm glad I got the pain out of your back and pelvic region. And, you know, that actually uncovered another um, an elevation in our friendship, but it uncovered yet more flaws in the medical system that you had gone to, three, four, five, six doctors at two, three, four institutions, and you had seen the chairman of X, Y, and Z department, and you had injections with you put to sleep, and you didn't move, and this and that. And at the end of the day, I made myself a little promise. I'm not going to brag. I'm not going to say I'm good. I'm not going to say other people are bad. But if I'm the only one out of 10 people or 6 people that got you better and it took one time and I talked to you, I evaluated you, I looked the way you walked, I saw how uncomfortable and I knew what to do, were the other people asleep at the wheel or were they trained wrong or were they doing something for money and they really don't know what they're doing? And, how come nobody would say, I think you should see a rheumatologist? Why did you have to meet one on the fly? And my training, uh, I've been in practice 31 years, so my training was 35 years ago. Back then, we were trained better, and sort of to motion into another topic area. You know, I think most people believe that the United States is in trouble. Well, you and I are healthcare kind of people. Healthcare is really in trouble. And one of the biggest problems in healthcare that I see from the treatment aspect to patients, the administration of treatment. And I'll preface, I want to say that all nurse practitioners and all physician assistants are very smart people. All physical therapists and chiropractors, they're very smart people. They had to get straight A's. There's no doubting their knowledge. However, I could have been with a 1.0 GPA right out of the Animal House movie, but what I was trained in, I know well. And even if I tell you hypothetically that my intelligence is lower than everybody, I know what I know. The other people are thrown into places where they really weren't trained and they try to wing it too often because it seems as though 90% of the people that seek medical attention don't really need it, but the 10% that need it are now getting the wrong treatment because perhaps one specialty over another may advertise better. So everybody will run to orthopedics, or everybody will run to the urgent care, or wherever it is the popular place to run. They all run there, and then they're referred from, oh, you got to go to this guy. Well, they're best friends and this and that. Or you got to go to that guy, and they have ownership interest. Or you got to go to that guy, and there's some other conflict that you're not aware of, and these things go on. And then lo and behold, there's maybe 6 or 60 of me throughout the country. And as a rheumatologist, I try to tell the patients, I say, if you have back pain, you need to see a rheumatologist first. They can tell you, look, you need a physical therapist, you need a chiropractor, you need surgery. And by the way, if you need surgery, go to the neurosurgeon that does the minimally invasive surgery. Now, why would I say go to the neurosurgeon, not the orthopedic? Well, I would say that because orthopedic spends 7 years, 1 year on hand, 1 year on foot, 1 year on ankle, 1 year on shoulder, 1 year on back. The neurosurgeon spends 7 years strictly on nerves of the spine and neck and head. So their training is superior in that aspect. But as it pertained to a situation such as yours where an injection helped, pain management people, they advertise anything that hurts is their field, whether it's rheumatoid arthritis, whether it's Lyme, whether it's fibromyalgia, whether it's osteoarthritis, whether it's back pain. But in the reality, they're trained to do epidural injections and they do them on everybody. And, the broken clock is always right twice a day. And they will get a couple of people better. But by and large, if people don't know what a rheumatologist is, they heard pain management, pain management, pain management. So they all go there. And if they don't get better, it's like, okay, you need surgery. So guess what? We have a surgeon in house. And you go to that surgeon who is just fed in house stuff that may not need surgery. So, of course, the procedure doesn't work. And this is a very vicious cycle because people in the last 15 years, approximately, they're not being trained properly anymore. And I can speculate many reasons why they're not being trained well, except I don't know why the teachers, if you will, the professors, I don't know why they accept that and go along with, oh, you can only work 40 hours as a trainee doctor when you used to do 100. And, I'm sorry, you have 2 or 5 years to learn your field. And when you finish and you get board certified, assuming you do, you only know the bare minimum to now progress into your field and start really learning. And it takes about another 7 years to be very, very confident and skillful, whether it's taking a history, whether it's putting together the history with the x-ray, with the blood, with the synovial fluid, um, and that actually mapping out, oh, you need an epidural. The epidural would be done by a particular pain management. Or, oh, you need a facet block. I will do that for you. Oh, you need physical therapy. Well, I went twice, it didn't work. So here we have a problem. Your insurance won't pay for it unless you went to physical therapy within a certain period of time, a certain amount of times, even though the patient says, I went twice and it hurt me more than it did me good. So we run into all these roadblocks. So there's so much overreach, and the overreach is everybody except the provider. So here I am, I'm in practice, I'm the provider. The medicine that I prescribe for patient X is denied. Okay, so I get on the phone and I try to do a peer to peer. I find out that it's a retired gynecologist. I'm like, sir, what do you know about what I'm doing? Well, I can read the guidelines. So, well, this is a problem. The guidelines and the speed limit are the same thing. They're arbitrarily put out there so that the person who knows nothing has a little guidance. So, if there was no speed limit and you're in high school and you got behind the wheel of a car one time, at least you'd know that driving 120 is you're going to go out of control compared to driving 50, 60, or 70. But in reality, when there's a high speed police chase at 150, you never see the policeman driving a wreck because they're experienced driving. They don't follow the speed limit, they're doing what they need to. Doctors that don't think out of the box have succumbed to the pressure of lack of training, overreach from the hospital, institutionalization of the provider. So these people that are working for the facilities in general, whatever the facility may be, if the facility is owned by private equity or by a hospital or by a health system or a government, you are owned by the system. And if you're told you have 12 minutes per patient, then right, wrong, or sideways, you're getting 12 minutes. But doc, I have a question. And the doc walks out the door because he's told 12 minutes, you're
Time's
done.
up. Time's up.
Yes. And you know what? So one of the biggest complaints I hear from people, or one of the biggest compliments I get is, wow, you talk to me. You talk to me, you listen to me, and you took my shoes and socks off? Like you actually examined everything? Like, yeah, that's the way I was trained and that's the way I believe. And that's how you actually find out what's wrong. And you don't have to punt it to a tertiary care center. And by the way, who do you think you're going to get at the tertiary care center? There's more training. You're going to start with a student, go to the intern, then the resident, then the fellow. And if you're lucky, the man or woman who's doing the research will pop his head out of the lab or her head out of the lab and say, I agree. How much time did he really get to know that person? He's relying on 5 other people, and they tell him it's gout, give him this and do that, and that's the end of it.
Well, listen, so there's a lot to unpack there, and, um, I wanna be clear that, neither of us are condemning or, talking ill about any specialty. I think the point that's trying to be made here is that you don't take your car to McDonald's for a timing belt change. You take it to a ASC certified mechanic. When you have a physiological problem that is tied to joints, you have options. You look at orthopedists, and I think the majority of people look at orthopedists first because they're a mainstream specialty. Rheumatology is a tiny specialty. I think if I'm not mistaken, there's only 5,000 rheumatologists in the country. It's a tiny, tiny specialty. But the way that I explain rheumatology to people who don't understand what the specialty is, they take care of train wrecks. Rheumatologists, more often than not, are a last ditch effort for patients who have been to everyone else. and they are hopeful that there's one last option other than being on something that distorts their ability to think, to rationalize, to function, and somebody who can not only treat the symptoms, but get to the root cause of the problem. And for me, I have been very fortunate to work with the National Organization of Rheumatology Managers. I have lectured for years for the American College of Rheumatology, and I've gotten to know some incredible rheumatologists. And I want to make certain that nobody listening to our conversation today is thinking that there is any demeaning or trash talking of other specialties. That's not the case. This is an opportunity to help people understand what rheumatology is, what it does, why it's so critical, and beyond that, I wanna talk about what I perceive as the corruption of the healthcare industry, because it is corrupt, and I have had an opportunity to see it firsthand. Now, I am always careful about my word selection, and I always try my hardest to clarify, especially when I use derogatory terms such as corruption, because I spend a significant portion of my professional life every year in trials, in federal and state court, both civil and criminal. And obviously, having a podcast that reaches as far as mine does, things get played during testimony, they get played during cross examination, and things get taken out of context. So I'm always careful about it, but I want to talk about the state of healthcare. And I want people to really listen to this story about Dr. Soloway, because if you don't think that the government will target you unjustly, you're about to hear an incredible story of just how unjust our justice system can be. So I want to unwind a little bit and I want to go back to a situation that, you know, m- um, came to light. So I was someplace and I get this frantic text, you got to call me. And I pick up the phone and I call Doc and I said, what's going on? And he says something about a grand jury. So let's talk about how this all came about.
I was at work one day and we found out that a particular government-based insurance carrier felt that I did too much work and that it was impossible. And um, rather than asking the question, how do you work so efficient and how do you do things so correctly and how do you have so many favorable claims from patients either online or wherever that you either saved their life or took away their pain or gave them their life back or diagnosed a problem they had for 20 years rather than asking the question as to how do you do this, because I am prolific and I'm falling in the top 5 or 10% of productivity. The people that are in charge of deciding whether you're a good person or a bad person, they automatically accuse you of being a bad person. So what they do is they go behind your back, they get patient lists, they get employee lists, they call, they go to the home, they speak to, they ask questions, and they ask maybe 200 patients, "Did you really go to his office?" "Yeah, yeah, but I really went." "Did you really get an injection?" "Yeah, yeah, I really got an injection." "Did the injection actually do anything for you?" "Yeah, yeah, it helped me." So after me finding out that this type of process was going on for years, um, I guess they threw a Hail Mary and said, well, we can't come up with anything, so let's just try to get a grand jury to, find him guilty of something. He must be committing fraud or anything.
And keep in mind, when a grand jury is convened, it is
Yeah.
for criminal purposes. So this was a opportunity for the government to get what is referred to as a true bill, which means the grand jury basically rubber stamps all of the allegations that are presented to them and any evidence or any witness examinations that take place during that grand jury. Now, my goal when Dr. Soloway reached out to me was to try to convince the prosecutor not to convene the grand jury. And I think that's one of the first things that we talked about, right? If there's a way to slow the process, to educate the prosecutor, and to help them understand that whoever they're listening to, whoever they've used to conduct an investigation, whether it was an FBI agent, whether it was an OIG agent, whether it was a unified program integrity contractor investigator, whoever it is, before you convene a grand jury, before you get them to rubber stamp your allegations and you go public and you potentially destroy an innocent person's reputation and their life, give us an opportunity. Now, these are situations where time is of the essence. You've got to move quick. And a lot of times with a grand jury, you don't necessarily get a heads up. We got a heads up because a former employee was subpoenaed to the grand jury and we just happened to find out. And we I consider that luck in all sincerity because it doesn't usually happen that way. Um the thing that I appreciate about Dr. Soloway when it comes to the business aspect is he will be the first to tell you he knows what he knows, and what he doesn't know, he will rely on people who have the competencies, the requisite skills, and the foundational understanding to do the job. So, my first phone call was to my very good friend, Ron Chapman. Ron is one of the most prolific white collar defense litigators in the country. His record speaks for itself. His skills speak for itself. Immediately, we put a team together. We then reached out to another attorney who I happen to know very, very well, and I've done work with him in the past, Saul Weissenberg. If you're not familiar with Saul Weissenberg, he is the attorney who was the prosecuting attorney during Bill Clinton's impeachment. He's been widely regarded as one of the best, and he is. Um, we sprung into action and we began our investigations. We engaged um, several people that got involved, former or retired law enforcement professionals from metropolitan police departments. We got retired OIG special agents that work with me involved, myself, kind of acting as the conductor under the direction of the attorneys. And the best part was Doc kind of sat back and said, I'm putting my faith into you guys. Now, we had a lot of late night conversations about stress and aggravation and the use of Imodium and Pepto Bismol. Um, but, you know, At the end of the day, we actually got a prosecutor who was willing to slow his roll and to actually listen to us and to put his ego aside and to say, convince me. Convince me that this is not a medically impossible day. Convince me that what this doctor is doing is not quackery, that he's not just sticking needles into everybody, that he is getting the results, that he is documenting the way that he's supposed to. One of the allegations, and this is so important, one of the allegations is that documentation in the medical records was being manipulated. Well, there was some truth to that. But the manipulation of the documentation wasn't being done by Dr. Soloway. It wasn't even being done with his knowledge. But the adjustments that were being made, as we figured out through a keystroke audit, were corrections. So if in his dictation he said a left knee, but it translated as a right knee, it was adjusted. Um, Diagnoses were taken to a higher level of specificity. But again, I put this caution out there to anyone listening, especially providers. You have got to set boundaries with your employees that nothing is to be changed in a medical record without your consent and without your knowledge. And nothing should be changed clinically without you doing it yourself. So let me pause there, and I want you to kind of walk people through your your different levels of thought process and, emotions as you went through what I think ultimately ran us what, 5 months, almost 6 months?
Easy, easy. Yeah. So first, the first thing is that when you're finding out that somebody's accusing you of something that you know you didn't do, the first thing is extreme anger. Um, and you really don't know where to vent your anger. So what you have to do is you do have to find competent people that you have to rely on to do their job very well. And Sean is the best there is, and his team is the best there is. And um, they reassure you this, and this, and this, and this, and they can give you a 99% assurance, but 1% assurance in a so-called God-fearing person, it really just tells me that if I wasn't feeling that way, I'm probably a sociopathic, criminal, because how could you not have a fear when you realize that this is the ultimate level of government overreach coming after somebody who's helping people on a regular basis for decades, not days, weeks, months, or years, decades. And so you start to get angry, you start to lose faith in the system, you start to lose sleep, you start to feel that maybe you're not doing as good a job as you should because you're never well rested. um, but What's most annoying is what I said at the beginning, where nobody did at any time and nobody will ever say, gee, how did you create a well oiled machine with X amount of employees? And, I'm just curious because I'd like to mimic your model because it works well. Now, interestingly enough, there have been rheumatologists that are, friendly with me, within 30 miles of me, that have all said to me, "Gee, we wish that we had a model set up like you." Probably the reason my model is set up this way is because 30 odd years ago, I came out here knowing that the area was, completely fertile and nobody was doing this career at all. So I got very busy and so on and so forth. And unlike the average person, I relished upon working more. In fact, they used to I guess, make fun of me that when I was a medical resident, God, this guy works every night. This guy works every night. And then when I was a fellow, God, this guy sees 15 people in clinic when you only have to see 5. I don't care about the minimum standard. I want to excel. Now, do I excel because I'm insecure? Do I excel because I went to medical school in the Caribbean? Do I? No. I was shoveling snow at 13 years old. I was a waiter at 14. I had jobs before I was old enough to work. My father worked till the moment he died. My grandparents worked till the moment they died. I think it's just, a genetic defect, overworking. Like Rodney Dangerfield said, my father was a workaholic. When he heard work, he got drunk. Except I don't drink, so I just keep working. Um, yes, it's a very, very heart wrenching experience because you're being accused of something by an agency that you can't fight, you can't win, you can't do anything. So you just have to believe that the truth will prevail. And one of the things that I fear, and I've seen this, over the last 8 years with politics, the truth doesn't always prevail. People don't want to hear the truth. People want to hurry up and, you know, put a stamp on somebody and blame somebody and then move on and get, their name higher. So maybe they can get promoted or maybe they could be this or that in their career. Um, with no, I mean, it's really malfeasance because all they're doing is trying to harm for self-improvement. I believe this is Schadenfreude. You get pleasure
From other
harming.
people's pain.
Yeah, yeah,
Mm.
because if they're not doing the job correctly, like for example, if you ask 200 patients about me over 5 years and every one of them told you, yes, I went there and yes, I was treated, and you ask 50 ex-employees, of which 20 hate my guts, if you heard nothing wrong, uh, what are you still doing? You just want to throw that dart anyway. The
Yeah.
dart board is closed, but we're still throwing the dart. And the fact that the government spends millions and millions of dollars, for example, bothering me, how many other me's are out there? Well, every specialty, if you're in the top 10% of your productivity, you are a target. So anyone listening to me now, if you're a physician, I don't care what your field is. I don't have to name any of them. Because if you're in a field and you're in the top 10% of productivity, just know that you are being targeted right now. And the
Yeah, I
more attention you bring to yourself, you write a book, you do this, you do that. Now all of a sudden, the government, our government in today's world, does not want independent, self-employed people. They want cradle to grave. And unfortunately, if you're a conservative minded fiscal person, you want to work and thrive or fail on your own. And if you do a good job, you want to be rewarded. And if you do a bad job, my board of directors is my patients. They'll tell me, you're doing a bad job. You didn't spend time with me. You're lousy. You made me wait. You did this.
and I wanna talk about the term conservative, right? Conservative minded. We're not talking about politically conservative minded, right? We're not talking about liberal versus conservative. We're not talking about progressive versus right wing. What we're talking about is somebody who finds himself from a middle of the road, centrist, moderate standpoint who says, "Look, my value in my mind is that I work hard, I treat people well, and I get compensated for that.
And I'm not owned by an
And
institution.
I'm
I
not
work,
owned by an institution."
right. I
That's right.
work for myself.
You know, I think one of the things that we have lost sight of, and it started, in my opinion, it really started back during the second Bush administration. It got worse during the Obama administration, kinda stabilized through the Trump administration, and then it's gotten out of hand with the Biden administration. So there's fault all the way around, and I always get people that say, "Oh, well, you're from South Georgia, so you're a Republican automatically." Truth is, I'm probably one of the most independent, minded people. I have voted both sides of the aisle, My philosophy has always been I vote for the person who I believe at the time is the least corrupt. And that's not always an easy thing to figure out. Um, but what I would say to people about the healthcare industry is it's broken. I am continuously having to argue on behalf of clients with individuals that are employed at the state level for Medicaid or at the federal level for Medicare to educate them on their own rules. I literally have, over the last 3 days, had 12 back and forths with a state to share with them their own manual. And hand to God, one of the attorneys actually responded to me and said, "I've never seen this manual before. I've never seen any of this language. It is fascinating." Those were his words. This is an attorney representing the Department of Health for a state. Now, again, for me, I'm very measured when I engage in a negotiation on behalf of a client. Because what I don't wanna do is I don't want to, pardon my English, piss the other person off who ultimately can bring a resolution to this thing or make my client's life a nightmare. So I'm very measured in how I go about these things. Um, I think Doc knows that firsthand because, over the last few years, I've probably had to rewrite 100 of his letters, because his letters are so passionate, because they're advocating for his patients. But sometimes, like other physicians who are just tired of the browbeating, tired of providers, or physicians who are working for the insurance companies who don't have the same training, the same skills, the same understanding as these providers, making clinical decisions on what's best for his patients. So some of the language gets a little colorful, but we tone it back. Um,
Sean, let's clarify
yeah,
for the audience that
yeah,
when you say rewriting my letters, that you're talking about specifically letters that I've written to advocate to get a patient a denied
that's
drug,
right.
not a medical record, not a
Oh, no,
note.
no, no, no.
No,
This is
right.
about getting
This is
this is
about
about
getting care.
advocating that's right.
Yes,
This is about advocating
right,
for patient care,
right,
not requiring them to take a medication
right.
that's not going to benefit them when
Yeah.
we know what will.
So to touch upon this, as you know, I've written hundreds of letters, and I admit they're very inflammatory. And before I knew you, 99% of the letters got a call from corporate somewhere, and I ended up winning the battles, but maybe that brought me higher on the look at this guy chart, you know.
And that's exactly what's happened, right?
Yes.
Because listen, you have had your share of now unannounced site visits.
Yeah.
You have had your share of inquiries now from the medical
Everyone,
board,
from everyone.
from the Department of Justice, from, everyone, as you've said. And, you know, I want people to understand that people are going to cast dispersions. They're going to create wild allegations because we work in a pay and chase industry. We work in an industry where you are guilty until you can prove yourself innocent, which is not how our justice system is supposed to work. And the fact is, because he has dotted the I's, crossed the T's, and he is truly an advocate for his patients, we have been able to have an easier job demonstrating, not convincing, but demonstrating through fact that everything that Dr. Soloway does is medically appropriate, necessary, and reasonable. period. That his work is in accordance with generally accepted standards of medical practice. And to simply attack somebody because they are a high producer, to simply attack somebody because they practice medicine the way they were trained 35 years ago, which was the right way, is an injustice to the entire system, and it's a corruption.
And most of the people that trained with me 35 years ago, they're all retired because they're sick of it.
Listen, I had somebody ask me, I did an interview at the end of 2023, or maybe it was the first week of 2024. And they were asking me about the cases that I worked on in 2023. And of the 10 cases where there were full acquittals, the question to me was, you had 9 cases with full acquittals, and they consisted of, I think, 13 or 14 defendants. How many of those physicians are still practicing after being fully acquitted? You know, no, 1. 1. And here's the crime. These were all physicians who were committed to their local communities. These were physicians who were committed to doing no harm. These were physicians who were committed to humanity, and they were struck down. And let me tell you where the biggest problem comes. Excuse me. An indictment is not a guilty verdict. An indictment, anyone can go before a grand jury if you have half a brain cell and present a story to a bunch of people who have no earthly idea as to what you're talking about. Because healthcare, after 30 years, I still struggle with some of the concepts that I hear people talk about. But an indictment does not mean somebody is guilty. It just means that somebody who is good at telling a story was able to convince a bunch of people who didn't understand the story that somebody did something wrong. And then the government takes that indictment, they send it to their PR team, and they put out a press release that says, indictment of a physician in the state of New York. The doctor is accused, da 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 da. But what they don't do is provide a disclaimer at the end that says, listen, these are allegations based on evidence that was presented to us, but now has to be litigated before a jury of his or her peers with a proper defense. This release does not mean somebody is guilty. I personally would like to see the publicizing of indictments stop. Only acquittals or guilty verdicts or settlement agreements should become public. An indictment is just that. It's an allegation of wrongdoing, and somebody is innocent until proven guilty. And that's where I think our health system is completely corrupt.
Well, it's allowed to be corrupted because the justice departments in the state and the federal levels have to produce work to show their boss, to show somebody that they're doing something. So they cast a web on high producers because there's little to gain from low producers. They cast this shadow, and they hopefully on their end they want to indict and take bad actors off the street, except they're not casting it at bad actors. They're casting a net looking for that one blue lobster, and they're getting a million red lobsters. And you know what? We'll sacrifice a few red ones because we think they were a little bit bluish.
Yep.
The fact that it's allowed and is condoned is what's going here. And it's clear that we have socialized medicine, and it's clear that the government wants doctors to be within these institutions. And an obvious reason to me is it's a lot easier to cast a net over 1,000 hospitals that own 1,000 doctors rather than chase down 1 million doctors individually.
Yeah. Listen, and again, I wanna preface what I'm saying with this. I have a lot of friends who are still prosecutors. I have many friends who are former prosecutors. My friends who are former prosecutors are not happy with the state of the Justice Department. Many of them. They've been on my program, they've talked about it. I won't mention their names. You can go and listen to them speaking themselves and hearing it straight out of their mouth. There are still good prosecutors at the Justice Department and around the country. I know because I deal with them. Listen, last year, we were able to get 8 qui tams, okay? 8 qui tams that were filed against providers. We got the Department of Justice in different states to close those investigations and to compel the relator and their attorneys to close those cases because they were bad cases. It was bad evidence. It was retaliatory in nature. So there are good prosecutors. Um, and they're mainly the ones who are career prosecutors, right? They signed on because this is their passion. This is what they wanted to do. Then you have some who I would refer to as what they call true believers. They hear something and it is gospel no matter what counter information you show them, and now they've dug their heels in, and we've gotta go to litigation, and, I've gotta do my job as an expert, and my team's gotta do their job, and their attorney's gotta do their job, and it usually turns out the way it's supposed to because people can see through BS, and and
And
and and that's what we talk about.
and
But
by the sorry,
go ahead, go ahead.
to add to this, I believe there are good prosecutors, and I will also tell you there are bad doctors. There are
Oh,
criminal
no
doctors.
doubt.
There are doctors that steal. There's doctors that rape their patients. There's doctors that do horrible things, horrible things. I wrote
That's right.
about them in both books, horrible things.
Yes.
But you know what? If they don't fall into the financial realm, nobody pays attention to them. They're murdering people, and it doesn't matter because they don't rise to what the government's looking for, which is ultimately money and fame for them.
Yeah,
And that's a sad, sad
in
truth.
some cases, I agree with you. Um, listen, I have said this for years, and I will say this until I retire in a couple of years. The system is broken.
Yes, it is.
The listen, the fact that Medicare wants all beneficiaries off of Medicare Part B and onto a supplemental program, Medicare Part C, by 2030 is clear evidence
Oh,
that
it
we
is
have
bad.
socialized medicine in this country. There is
Yes, it
no doubt
is.
about it. Um, you can point to you can point to the globalization that some want to see where we are a global, you know, no borders anywhere on any country, and just look at what transpired in Davos. I mean, you wanna talk about the highest levels of hypocrisy. They are supposed to be there, advocating for the environment, yet 1,000 private jets flew from all over the world, creating the largest carbon footprint, and they do this every year to talk about how do we reduce carbon footprint. Well, why don't we start by not flying 1,000 private jets around the world? Listen, private jets are great, and certain people have a right to use them. They should use them. But when you're somebody who is standing at the top of the mountain, as they say in Italian, Capodimonte, and you are screaming, the environment, the environment, the environment, flying around in a G4 or a G5, for those of you that are not familiar with that,
650,
a
650.
Gulfstream or a
Tho
Gulfstream 650
those
EX
billionaires are not flying in on anything less than a
than a
650.
650. I agree with you. The hypocrisy and the tone deafness is mind-boggling. But I'm not gonna go down the road of politics. 2024 is already heating up to be one of the, I think, craziest years that we're going to see. Um, I'm not getting into predictions about who's going to be the next president of the United States. I have my thoughts, I have my concerns, um, and at the end of the day, what I think really doesn't matter, um, because it just doesn't. But
Can I throw in something
go ahead,
about,
please.
um, I want to just touch upon this because it's very relevant to our conversation. It involves peripherally politics. By having an open border and knowing that the people that are coming through the open border, and I'm not singling out a country, but I'll say underdeveloped countries, whether it's Syria, Iran, Iraq, Afghanistan,
They're coming
Yemen.
from around the world.
No,
Bottom line.
but if a British citizen comes, they were probably vaccinated at birth for all the stuff that we eradicated here. The point I want to make is we are now having to recheck ourselves for polio immunity because the people are coming in with polio, and not all of us have retained our lifelong immunity. I had to check mine and I have lifelong immunity. We check a lot of people. Not everyone has lifelong immunity. We've seen 2 cases of whooping cough in this office in the past 12 months. Why? Because people who didn't vaccinate were exposed to immigrants or individuals that were never vaccinated. Diphtheria, in these little areas down by the border, you're not getting colds, flus, or even COVID. You're getting cholera, diphtheria, polio, tuberculosis, the stuff that we're not used to seeing, which we all thought were eradicated, at least from this country, are now being introduced in our country. And I'll keep it medical and I won't expand on this topic, but that's the medical aspect of keeping an open border is that all the diseases that we don't have, now we have.
Listen, here's the thing, and I'll end by saying this. Um, we are a melting pot in the United States. We have been since the inception of this great land. Um, all who wish to come here should be welcomed, but come here through the proper process. Those who have immigrated to the United States in recent years will tell you they are up in arms that they had to wait 2 years, 3 years, 5 years to be able to get permission to legally cross the border to come to this to this country. My family, my on my grandfather's side, they escaped Germany during the Holocaust, fled to Russia, and then were able to come to Ellis Island, but they came the right way. My grandmother on her side from Italy, they fled from the dictatorship and they came through Ellis Island. They came through. Again, this is not a political statement, but this is we're talking about the health and safety of all people, because our country is made up of those who are naturalized citizens, those who were born here, those who, you know, have the privilege of being a United States citizen, to those who immigrated here, went through the process and became nationalized or naturalized citizens, or they have their green cards, or they have their visas, or they have whatever they're supposed to have to be here. When we have people that are flooding into our country and we don't know who they are, we don't know their origin from where they're coming from, we have no medical records on them to help take precautionary measures to prophylactically treat them before they enter into this country, we now run the risk of bringing diseases that have not been seen for 30, 40, 50, 60 years into our country and exposing elderly populations that have repressed or depressed immune systems, those who have significant health issues with compromised immunity, and the young generations, the babies, the infants, the toddlers who have not been fully vaccinated to fight off the things that are now coming into the country. So this is not about wanting to close the borders because we don't want people here. This is about wanting to put precautions in place so that when people do come across, we know that they don't carry diseases with them that expose all of us and put our health at risk. That's what this is about. So I'm sure some of you are listening and you're like, "Oh my god, you're a hateful person." I'm not a hateful person. I love everybody. I just want people to follow the rules, to follow the laws that are on our book, and to recognize that there are people out there who despise humanity because they don't want to change the laws. They want to change the people who enforce the laws so that they don't enforce the laws. All right.
Well said.
All right, my friend. As always, it was a great conversation. I love getting a chance to sit and talk to you. Um, I hope those who have been struggling with joint pain, back pain, lupus, with any type of rheumatologic condition that has not been treated to the level that they would hope they could be treated will seek you out
You
and
know, can I
get
add one
help.
thing?
Please.
So, in one sentence, my vision of what a rheumatologist is and what I was trained to do was rheumatologist is the bone doctor because we don't operate. So if me as the bone doctor can drain your joint, inject your joint and make you better and tell you, oh, this is gout, this is lupus, we'll put a treatment plan together. If I inject your joint and this and that is wrong, I'll get you to the surgeon. Now, I'm not saying people shouldn't go to these other specialties. I like these other specialties. They all have a niche. Nobody knows what we do. So we are bone doctors. And also, I wrote two books, and I'll give my book a little plug. Bad Medicine and Medical Politics. Medical Politics is forwarded by Sean. These books can be obtained at badmedicinebook.net. And I want you to know that in each book, at the back of the book, there are chapters describing and helping and giving layman's descriptions on osteoarthritis, gout, rheumatoid arthritis, osteoporosis, and many other pain syndromes, whether it's neck, back, shoulder, hand, wrist, elbow, shoulder, hip, knee, foot, ankle, etc., and all the other conditions of muscle, cartilage, joint. So they're not necessarily meant to be any political statement. They're actually meant to be informative. So they're written for a wide audience of people. I just wanted to mention that it's badmedicinebook.net. And if you order it through us, I will sign it and personalize it to anybody who's interested.
All right, I will make sure that I put a link and description of the books into the, description of this podcast. Again, I wanna thank my very good friend, Doctor Stephen Soloway, for taking time out of what I know is an extremely busy schedule to sit down and spend some time with me. And to each and every single one of you, thank you so much for tuning in, logging on, and hanging out with me for a little while. I'll be back next week with another brand new podcast, so until then, remember, be good to yourself, but more importantly, y'all be good to each other. Take care.